Good afternoon. Welcome to today's COVID-19 update. I'll ask Professor Spurrier, the Chief Public Health Officer, to give us the update.
Good afternoon, South Australians. Giving an update, and we're the second day after we have opened our borders. And not unexpectedly, we do have a case of COVID here in our state. And it's not something that should be unexpected, because we know that we do have cases of COVID in New South Wales and in Victoria, but I'm going to give you a few of those details. But I just want to make you aware that this is not something to be alarmed about. We've got a very well vaccinated community here in our state, and our contact tracers got right onto this positive case, have got all the information they need, and everybody is now in quarantine who has been in contact with the case. There's this one new case. We have 3 active cases in our state and 2 previously reported cases from overseas. And just before I get into any more details about this particular case, to say that we had nearly 7,000 COVID-19 tests done yesterday. Now, some of those people will be South Australians who have woken up with a bit of a sore throat or a runny nose, and thank you very much for getting tested. This is going to be critical going forward, that anybody with mild symptoms gets tested during this transition phase as our borders have opened up. But also many of those people will be travellers coming from interstate, and there is a requirement for certain groups of travellers to also be tested here on arrival. And so that probably explains some of those tests. Now, a really important milestone as well, that we've had 79% of 16 and overs now fully vaccinated in our state, so just shy of that 80%, and I'm sure we will be reaching that in the next day or two. Also, a very high rate of first doses. I think that was 88% when I had a look earlier, which means that we will be on track to reach that double dose 90% and over fairly soon. So let me get back to a little bit of detail about this case. And this is a little girl from Victoria. She arrived yesterday with her family to visit relatives, and on the way, and this is part of all public health systems, her mother received an SMS from the Victorian Health Department saying that this little girl was a close contact of a case, and so the family stopped in and got testing done, and then travelled on in to visit the relatives. Now, that test result, which was done in Tailem Bend, came back very promptly, and we had that result this morning, suggesting that this little one is in the early stages of an infection, and obviously because she's a child, she was not able to be vaccinated. But all the adult contacts are fully vaccinated. Now, the family made the decision to go back, because these people were living close to our border, to go back and quarantine back in Victoria, and that's what they're doing at the moment. And so there are 2 close contacts in the house, which are relatives, fully vaccinated adults who will be doing their quarantine time here in South Australia. Now, like we've always done when we have outbreaks and we have cases, our contact tracing team has done a detailed interview with the mother, and there was no other what we would consider exposure sites. And I thought maybe I'll give you just a little bit more detail, given that we're moving into a different phase in the pandemic, was that the family, if you would imagine driving with young children coming from another state, they did have a toilet stop and toilet break, but our team has assessed that, that break and where they stop, and do not feel that there's any need for any other close contacts to be SMS'd or contacted. So that's the end of where we've got to today. So there's no other exposure sites. So the real message is that we are going to have cases in our state. And if you haven't already got vaccinated, you really must seek at the earliest opportunity and go and get yourself vaccinated, because that's how you will be protecting yourself. That's also how you'll be protecting other people around you and your greater community. And we will be seeing more cases in coming days, and our contact tracing team will be doing the job that you know they're very good at doing, and will be following up all of those chains of transmission. But it really is very important now for people not to be sitting on the fence and thinking, oh, maybe I'll do it tomorrow, maybe I'll do it in a couple of weeks. Maybe I'll do it when the school term finishes and when the school breaks up. Now is the time to go and get vaccinated. We've seen a great uptick in vaccinations in our state. South Australians know how to do the right thing. Please keep doing those right things. So as we move forward now, over the coming days and weeks and months, we'll continue to need to have people following our public health directions and advice. So for between the 80% and 90%, totally critical that anyone with symptoms gets tested. Absolutely critical we keep up our hand hygiene. Stay your 1.5 metres away from other people that you are not close contacts with and you're not within your own group. Masks are here for a little bit longer, so please keep those masks in your pocket and make sure you're wearing those in any public space. Just again to reiterate the importance of getting vaccinated. Now, I had an opportunity, because I did a bit of radio this morning, that we did have another case. So again, we'll be starting to see more cases coming through, and I get these on my phone as they come through. And there was a positive test again last night. Now, again, we'll be getting more of these coming through. It was a person that was already a case from Victoria. They had done their quarantine time, they'd been in isolation, and they'd been cleared by the Victorian Health Department. And so this was an example of virus shedding. And we get a little bit of an inkling about this, because when we do the testing, we can see how infectious the person is likely to be. This person was, even on the swab result, it looked like it was not an active case, and that was confirmed with that individual that they had the clearance papers and was already known to be infected as part of an outbreak earlier a couple of months ago in Victoria. So as I said, this is going to happen on a regular basis, and I just thought it was very important to inform the public that we do have our first case within our state, and our system has worked. It's been picked up very early, thank you to this mother, and the appropriate quarantine has now been put in place. So very happy to take questions, and of course Minister Wade is here as well to also take any questions.
Just to clarify, so there are 2 adults in South Australia. Are they relatives of this little girl that they were coming to visit?
Yeah, exactly. Yep.
So they're now in quarantine for how long?
So if they're fully vaccinated, they will have the 7 days of quarantine. So people, remember we talked about, and I know somebody told me it was like a spaghetti, bowl of spaghetti, this matrix we put out a week ago about our TTIQ or contact tracing going forward. But the important thing on that, the simplest thing, is that if you're vaccinated, you have 7 days of quarantine, and if you're unvaccinated, you have 2 full weeks, that 14 days of quarantine. And we still require the testing, so our team will be organising testing with these 2 people.
Can you give us a bit more information about the girl? You said she was a little girl. How old is she?
Oh, look, we wouldn't normally give out ages because it's more identifying, but it's a child that's less than 12, so could not be vaccinated.
And the 2 adults that are in quarantine here, are they grandparents of the child? And the child's obviously come across their family and visited them in metropolitan Adelaide.
So, yeah.
Tested, gone back to Taylor then to be tested on the way back to Victoria?
No, they had come over, got tested on the way, came down to visit their relatives, and again, just, you know, in terms of people's privacy, it's better if we just say it's the relatives. There's no public health reason to make it any more complicated than that. And they got the SMS as they went, got into South Australia, went and got tested, and the mother and the other child, their tests are negative. They came down, visited their relatives, but then we got the result this morning, and that the family was informed.
Okay, so you said, sorry, just to clarify, the family is in Adelaide?
Yep, so...
Whereabouts in Adelaide? North, south, east, west?
Look, again, it's not relevant from a public health point of view because there's no other exposure sites, but the relatives, that's their house, and so they'll be quarantining there. And the family, we could have made arrangements for them to quarantine in South Australia, but it was easier for them to go back home, back across the border to do their isolation and quarantine period interstate.
And just to clarify, sorry, the travelling party, it was the mother, the young girl who's tested positive, and another child?
Yeah, and another sibling. That's right.
No one else?
No, nobody else.
The other child was old enough to have been vaccinated?
I think they were both less than 12, so both unvaccinated, and one of my predictions was we'd probably have a case the second day after we opened the border, and it was likely to be a child because I know what the epidemiology is like interstate, and indeed that's what happened. But I think on one hand, I can reassure South Australians that we got on top of this because the testing was done quickly and it was quite straightforward. There hadn't been any other close contacts. But on the other hand, this should be a wake-up call for anybody that is not vaccinated. We are going to see more cases come into our state, and it's important that you're not still thinking we've got an elimination strategy. We are expecting to have cases here. Vaccination will do our heavy lifting. We continue to have public health and social measures, and we need to keep doing the contact tracing. And as part of the contact tracing, getting tested is really important.
Is there the real concern here with children under the age of 12 who can't be vaccinated, that they will be bringing the virus into South Australia in a sort of super spreader way, potentially, to the unvaccinated here?
Well, it is a reality that children cannot be vaccinated, but I wouldn't say that kids are super spreaders. We know that children can pass on the virus to other people. Certainly they can more with the Delta strain than earlier strains, but children in general mount a very strong immune response, and they tend to become less infectious more quickly, so they tend to get on top of the infection more quickly, which is why children often don't have many symptoms at all. They can still pass on the virus though, and it's really nothing that we can do about that at the moment because we know that that age group cannot be vaccinated. And the most important thing for parents who are worried about this is to get themselves vaccinated, as in this case, all the adults have been vaccinated.
Should there be mandatory testing for children who aren't vaccinated then as they enter South Australia?
So we do in fact require that at the moment for our people coming in from those particular jurisdictions where there's community transmission. But one of the things, and I've raised this already with SAPO, our police, is that for our border community we didn't have that requirement because our border community in a sense has had more testing than anybody else in the state, and we're just going to have a look at that. We're also going to have a look at where this little one's likely to have picked up the virus. In times when we've not had our borders shut, we do very close work between communicable disease branches. It's called a jurisdictional outbreak. So we'll be seeking information from Victoria about where this child is likely to have picked up the virus, and then if we need to, we'll put in other public health measures if it looks like there's going to be a significant risk from this particular event.
Is there any sort of suggestion that perhaps this family has maybe misinterpreted the rules about where they should have gone after being identified as a contact of the case?
Oh, no.
Should they not have come to visit their grandparents?
Oh, no, not at all. They got the SMS. No, not at all. Not at all. So that
should they have come after getting the SMS? Should they have sort of been tested and then gone home, or was it okay for them to come to their grandparents?
Well,
to their relatives?
yeah. I mean, well, look, every situation's different. As I understand it, because they'd had that information, they got the test done as soon as they could. They were already driving, so it's very difficult when you're halfway to a destination to know which way to go. And you've got a family with young children in the car. So my understanding is that there may not have been a lot of hugs and kisses, unfortunately, for this little grandchild. And the grandparents are fully vaccinated. So I don't think there's any criticism at all for this family.
In regard to the case, the old infection from Victoria, are you able to provide some more details about that? Is it male or female and the age?
I don't have that level of detail actually because, as I said again, it's not an active case. It's not going to be counted towards our numbers here in South Australia. It's of no risk here to our community. It's just something we're going to start seeing a bit more of, positive testing as we go forward, and it'll be people who have had old infections. It's not to say don't get tested if you've got symptoms just because you've had COVID before. Certainly don't hear that message, but it's just something our pathologist will be very well aware of. And this is the same as we've had with international arrivals. There's been a handful of international arrivals over the past couple of weeks who have been old infections, and we don't necessarily report that. But given that we've just opened our borders, I thought it was useful for the public just to remind them about some of the things we've talked about before that people may have forgotten.
Just to clarify, and I'm pretty sure I know the answer to this, they're not linked, the two cases, the Victorian case from this morning and
No.
everyone this afternoon?
No, absolutely not.
Do you have an update on the wastewater, the positive wastewater sample at Victor Harbour?
Yeah, I haven't got that one back yet, so let's wait and see. Our experience has been when we haven't had any community transmission, we might get a wastewater test and then it will go negative, and it's likely there is somebody in that catchment who has had COVID but has recovered, so that's a possible and most likely explanation. But we watch these very carefully, and in fact for us in this new phase, it's a really good sort of trigger for us to think there might be something else going on if we keep getting a heavy signal. In fact, this exact question has been in Katherine LGA. As people know, in the Northern Territory, the wastewater has been positive in Katherine, and it preceded them picking up the additional cases. So we'll be monitoring that.
Professor, you said that you expected the first case to come here to possibly be a child. Could you explain why that was?
Sure. So I catch up with the Chief Health Officers in the other states on a regular basis, and they provide more detailed information about their outbreaks and how they're controlling those. So I was aware that there are quite a number of school outbreaks in Victoria, New South Wales and also ACT. So that's why I would have made the prediction in that way. I did have inside information.
Professor, can I just ask, are you super confident that this family has not travelled to any other locations through South Australia? As parents that would have young children would attest, it's very challenging to drive from Victoria to Adelaide, with it even stopping at Tailem Bend without some sort of rest breaks and visiting other places. How confident are you that there are no exposure sites, and how do you know that?
So people will appreciate that we take detailed histories from cases or their relative, in this case as a child. And during the epidemic, people understand that one of the complexities is human behaviour. So our contact tracers are really good at making relationships with people. They understand that that information is kept confidential. We're using it for contact tracing purposes only. So we feel quite confident in this situation. But maybe just to put this in a different light, as we move forward and we have a very well vaccinated community, our forensic approach, which people will be used to in the past with CCTV footage and looking at credit card details and such like, when we start getting more cases in our state, we will not be using that more forensic detailed review of people's movements, because we're in a different phase. We are expecting to have cases. We are going to have to live with this disease. Not to say that we will not be doing the best contact tracing that we possibly can, but going into digging into those details, I think, will be a thing of the past.
Where are they from in Victoria?
So I haven't got the absolute details on that, and as I said, I'll be following that up with the Victorian counterparts. So I know that they came from a country town called Nil, but I don't know where the exposure was for this child.
And could you just confirm, so it was she was travelling with her immediate family, is that right?
Yes, exactly, yep.
Professor, you're saying that there's nothing to be alarmed about, yet you've called a snap press conference to brief the public. Are you concerned that you're actually inadvertently alarming the public by coming out and saying there's a case but actually nothing to be worried about and it's a child? And what's your
I mean, really, in my job, you're damned if you do and you're damned if you don't. I think it is important for South Australians to appreciate, with the border opening, that we are going to expect cases. We're in a different phase. I think the public, to be completely respectful to our community in South Australia, they'd want to know about this. But on the other hand, I need to be able to provide the advice around that we are moving to a different phase and we will be starting to expect cases. What we will be wanting to tell people about is if things are getting larger than what we expect in terms of outbreaks, and in particular LGAs, if we have to put in any other public health measures to have containment, and that might be having reactive immunisation in particular areas and the like. Or it might be in regional communities where additional messaging is required. So, you know, COVID hasn't gone away. We are going to be in a phase which is uncharted water. It's probably uncharted in terms of the whole world, because we have had the very, very lucky position of being able to get vaccinated before we have this disease in our state.
Would today's case which has sent 2 South Australians into quarantine enough to be considered community transmission from the Western Australian government's standpoint? Could we see ourselves locked out of Western Australia from today onwards?
Oh, look, that's really up to the Western Australian government. I wouldn't consider this community transmission. It's all linked. We've got a child that's caught the disease in another state. We have 2 people exposed here in our state. They're in quarantine, so I don't think you could consider that community transmission.
The Adelaide Festival has been asking whether there's going to be some kind of mandated double vaccination. They are wondering whether you're going to make any moves on this because their hands are tied at present.
Well, I would say that nobody's hands are tied to get vaccinated. And there are some positives about mandating vaccination from a public health point of view, but there are also some negatives. And there's a lot of power in individuals being able to make the decision to protect themselves, but also to be doing this to protect other people in their community. And if the government makes a mandate, that takes that power away from people. So we are walking a line in South Australia that might be a little bit different to other states, where we are keeping some public health and social measures in place that protect our whole community as we have this disease coming in. I've provided advice for mandating a vaccination in places where there are very vulnerable people, where vaccines may not work as well, and that's in our hospitals and aged care and disability, for example. It is absolutely fantastic when I hear that other organisations like the Zoo and the Oval and in some other, there are other small businesses that are starting to get online with this. They've made a decision that they want to protect their own workforce and their own workers from COVID, and they've been able to make that decision. We are able to support that, and I should say Department of Premier and Cabinet, by having the Vax check-in be able to be an easy way for those businesses to check the vaccination status.
But Professor, they're asking for that support, but as a statutory authority, they can't apply that. They're asking for your assistance. Are you considering that?
So I'm not sure what they mean that they are not able to apply that. Other organisations have obviously been able to do that. So I think we've found in South Australia that if government walks hand in hand with individuals in the community and businesses, we can get over this pandemic together rather than having a very heavy-handed government-driven approach. Of course, when we need to, we will make mandates and we'll have directions, but I think that there's different ways of doing that.
Professor, how's the little girl and what symptoms did she have?
So she didn't have any symptoms. I think she's pretty fine, but she's probably feeling a little bit sad that she's not been able to have kisses and cuddles, and she's heading back across the border back to Victoria. But hopefully when she recovers, she'll be back here to see her relatives again.
Just back on the town of Neil, it's obviously a cross-border community, and they've been able to travel through that bubble before yesterday. Is there any concern that perhaps this girl was infectious and possibly travelled into South Australia within that border?
No, not in this circumstance, but I think this is the next phase for us in South Australia, is starting to appreciate there will be COVID in our community, and it is time to get protected. If you're being vaccinated and you're wearing your mask, you do all those things, then you'll be fine. The people I'm worried about are people that are not vaccinated yet, and those are the people that I would just support as much as I possibly can to go out and get yourself vaccinated.
Professor, from today onward, what can the public expect when they hear that a press conference is going to be called from SA Health? Is it something they really need to watch? Is it big news?
So one of my jobs as the Chief Public Health Officer is to communicate to the public when there's important things to communicate about. And one of the reasons I felt it was important to tell South Australians today about this being a case is a reminder for people to get vaccinated, and that we have changed. We're in a different phase in our pandemic now. We'll start to see these cases come in. Now, that won't be necessary to give press conferences every day when we might have 2, 3, whatever number of cases, but I think that there will be times when we need to have a press conference, particularly if there are particular areas where there's increasing case numbers and we have to do a bit more in terms of our public health measures. And that's so that I can inform the community, because we fight this pandemic by the community being on board and us all doing it together.
Professor, can I just ask you a technical question? Are you classifying this little girl is the state's first case since the borders opened, or is it the Victorian case from this morning who was deemed a case in Victoria?
So a technical answer to that is this would be this little girl. She got tested in South Australia, so she tested positive in our state, so that will go to our state's numbers.
Whereas the Victorian one from this morning won't be,
No.
but they got picked up here as well.
Yep,
Thank
exactly.
What kind of numbers do you expect to see in the next few days?
This is where my crystal ball gazing will come into its own. So it's really difficult to say. We've had a large number of people come into our state, and I hope that other South Australians really felt happy when they saw the joy on the faces of the friends and relatives that hadn't seen each other for a long time. But it does mean that we will start to see more cases in our state. Honestly, I can't predict. My prediction was that we would have one in the next day, and we did, and it was going to be a child, and we did. But I can't go any further than that. Sorry, Andrea. Let's just see what happens.
So you've had no modelling to indicate the cases that would be coming through?
So, of course, we have had modelling done, and you're very welcome to have a look at that. It's all up on our website. And that was predicated on having seeding of having 20 cases a day for 30 days. But that's not exactly the same as what Andrea's question is how many are we expecting? So that's going to be the number of people that come in from Victoria and New South Wales, what their current caseload is, and that will be dependent on what their vaccination rates are. And with time, when we were doing all this planning 2 or 3 months ago, the vaccination rates in those states were a lot lower. As their vaccination rates have gone up and their numbers have come down, of course, that's a lower risk here for us in our state.
Do you think that South Australians would be concerned that you're saying you've got no idea what the numbers might be over the next couple of weeks, given that you chose to open the borders?
Look, I think South Australians appreciate that we can do predictions, but it is, as I said, very dependent on those things. The number of people who are coming across the state, we've had a look at what the numbers have looked like in the past. So I've got information from our Tourist Commission on the numbers that we had travel between the states in 2019, but we've had state borders closed. So I know there's lots of people that are really keen to cross those borders now. So it's very difficult to be basing that on 2019 data. And as I said, we can't predict what the vaccination rates are doing in other states, and they are really looking excellent. So you can have another look at our modelling to see what it shows. But the real reason for doing that modelling was planning for our acute health system to make sure that what we were doing in South Australia in terms of our restrictions, in terms of our vaccination rate, and in terms of our contact tracing and testing meant that our case numbers would stay low enough not to overwhelm our health system.
Professor Spurrier, just on pregnant women, what is the policy? We've been told that some who aren't vaccinated are being turned away from giving birth. What are the rules?
Oh, I find that very hard to believe. Of course, if you're giving birth, you're going to be welcome in any health service. But what we have said is that if you are pregnant and you're a healthcare worker, pregnancy is not a reason to not be vaccinated.
Professor, you have a very powerful position in the medical profession, and you sit on some very powerful panels. Would you like to see vaccination of under 12s sooner, as soon as possible? And what's your public message to those groups that make those immunisation decisions, given the fact that you have predicted a child and we've got a child that's infectious now in our community?
So the one group of children that concern me the most, and this is because I'm a paediatrician, are the children with chronic health conditions. And those are children who have problems with their immunity. They might be getting chemotherapy, or they might be born with a low immune system. And they also are children who have got congenital heart problems, children with lung problems such as cystic fibrosis and the like. And those children will have more difficulty if they catch COVID. And those are the group of children I'd like to see as prioritised having vaccine going forward. Now, it's very important when we are providing advice about vaccination is that we have full information about any side effects. The clinical information that's been provided by Pfizer for the Pfizer vaccine is that based on clinical trials, there's a large number of children now that have been vaccinated overseas, and that's the real world data. And I know that ATAGI is getting that and looking through that. So I would be waiting until all of that's been looked at, and if that comes out with a big tick, I would be absolutely recommending vaccination for the 5 to 12-year-olds.
Do you think it's appropriate, if that's the case, that children who aren't vaccinated are forced into some of the mandatory quarantine and things that we ask, or do you think that perhaps that should be left aside and children not imposed by that?
Yeah, so children can pass on the disease, and unfortunately by default they're not vaccinated at the moment, so they will require to have 14 days of quarantine as opposed to the 7, and that's just the way things are at the moment. We've tried to make some, and that's for children that are cases. So we have tried to have some leniency around close contacts, and you'll be able to look at those details in our matrix.
But parents can expect in the future, when that age group is eligible to be vaccinated, that kids will fall under the same category as everyone else.
Well, we just have to follow the biology of the disease, and we know that vaccination reduces the ability to catch the disease and transmit it to other people. And so it's not about discriminating on age, it's just working out what the biology of the virus is.
In regards to the regional quarantine centre, why was the tender for that only put out on Monday?
Yeah, so I had quite a long discussion on radio this morning about that. In fact, our planning for quarantine facilities has been a long and drawn-out process, been going on for over 12 months. Of course, we had our Medi hotels, but we've also scoped out other quarantine facilities. People may remember, if you're down in Mount Gambier, that we even had one of the hotels down there as a quarantine facility for a period of time when we needed that for cross-border arrangements. We've had Paringa Resort, we've looked at Parafield, we've looked at quite a number of places. So this is the call for tender, which is the necessary procurement process, given that we are likely to require more quarantine for people in different areas. So I wouldn't feel stressed about the fact that it came out on Monday. We've had lots of conversations with many people in this space, and it's just part of that process.
So should it have been up and running before we opened our border on Tuesday?
Well, in a sense, you don't want to be putting up a whole lot of quarantine facilities that are not needed as a fixed structure, because it's not just a facility, you've got all the staff there. And we don't want staff sitting all over the state waiting for an outbreak that may never happen, because we've got other things in place, obviously, with the contact tracing and our vaccination rate. So it's very difficult to predict where we might need it. So I think this is absolutely fine, the timing of this. We didn't have any outbreaks prior, we didn't have a need for it, but it's just a recognition that not everybody can quarantine in their own home. We've learnt that from Victoria and New South Wales.
There are some people who are in quarantine, who were in quarantine before our borders opened, who wouldn't be in quarantine if they crossed yesterday. Have you given any consideration to releasing them from quarantine?
Yeah, so that's actually already been considered, and those people who were from New South Wales and Victoria will now be under the same rules as anybody else. So if they had still got a few days to go, then they wouldn't have to complete that. But very importantly, we wanted to make sure all their testing had been done. That doesn't apply to international arrivals, however. Any international arrival that had the 14 days of quarantine needs to continue with that. But then from the 23rd, it's 7 days for vaccinated international arrivals.
How has that been communicated to those people? Because we've had a number sort of emailing in, saying that they can't get a straight answer from SA Health and they're still in quarantine.
Okay, well, I'll take that one on notice. I was asked over the last 2 days and had given my response, in fact, I think about a week ago. So I'll follow that one up, and thank you, Andrea, for alerting me.
Okay, so what should we be worried tonight about this new outbreak, and what's your message to the community?
No, what we need to remember is we know what to do in our state. We've already been through this before. We know what we did last year and it kept us safe. We now have vaccination. I don't think people should be worried. I think they should feel very confident if they're vaccinated, and if you're not vaccinated, you can feel confident because you can get a booking, or you can go in this afternoon and go and get your vaccine done. And then you can start to feel more comfortable, like the almost 80% of other South Australian adults who have already been vaccinated. We also know many other things about this disease. We know about the hygiene, we know about getting tested if we have any sniffles or sneezes, and we know about keeping our distance. We also know that being out in the wonderful South Australian outdoors, and our weather is usually good. It's not so good today, but generally we have great weather. So if you're going to have any Christmas parties, catch-ups, maybe consider doing that outside in a better ventilated area. All of those things add up. They're all protecting both ourselves and our families and our community.
Can I just ask the Minister one quick question? Minister, the Premier earlier today said that the number of children that this was going to impact was going to be, I think the word he used was minuscule. On a day where we saw ramping at the Women's and Children's Hospital for the first time, do you agree with those comments, given that the new case is a child?
Certainly the events at the Women's and Children's Hospital have nothing to do with COVID. There was an unexpected surge at the Women's and Children's Hospital yesterday. Within a relatively short period of time, the staff there dealt with the surge. I think it's important to appreciate that the average transfer time yesterday at Women's and Children's Hospital was below the benchmark. Every hospital will have surges. Women's and Children's had one yesterday.
The surge might not have been anything to do with COVID, but we are now, as the Professor said, entering an era where we are going to have COVID cases, and today's case was a child. And it stands to reason that we could see many more children infected with COVID. I mean,
well, there
pressure already at the Women's and Children's Hospital. Is it equipped to cope?
There are clear positive initiatives being implemented at the Women's and Children's Hospital. For example, the virtual urgent care service, specifically responding to people who might need urgent care, has been in operation since the end of August. It's been extremely successful. Almost 700 families have been able to receive urgent care through that service, meaning that they don't need to go to the hospital. They can get the care they need from the comfort and safety of their own home. Also, we're putting in place the COVID Kids care service. So if we do have COVID positive children, they will be able to be supported with online support in their own homes. If they need to have face-to-face care, they can get that from a dedicated unit at the Women's and Children's Hospital. I believe the Women's and Children's Hospital is COVID ready.
You've lost quite a lot of staff who are unvaccinated at the Women's and Children's in particular. Are you concerned by the level of service that's going to be provided there? Is it going to be reduced or suffer because of this?
No concerns have been raised with me anywhere in the health system that will have significant impact on clinical services as a result of the staff who are no longer going to be available because they're not willing to be vaccinated.
You say significant. Will there be any impact?
Well, there'll be impact because those people are not there and they need to be replaced.
Minister, you say that there was an unexpected surge yesterday that left the Women's and Children's Hospital having ramping for the first time. Is it not? Does that not show that the system is quite precarious at the moment, where you can get an unexpected surge and you get ramping, and we're about to have COVID in our state? Like, I'm not sure how you reconcile with that.
The fact that there is a coincidence of a cluster of 000 calls doesn't say anything about the system. It talks about the unpredictable nature of human circumstances.
Yeah, but doesn't that then go to show that the system is not ready for an unexpected surge? If there was an unexpected surge, surely you'd be able to say, well, actually, it's fine, we can deal with that. But the Women's and Children's Hospital couldn't deal with it yesterday.
No, the Women's and Children's Hospital did deal with it. In a relatively short period of time, the surge was dealt with, ramping ended.
What's the message you have to parents who have their children ramped, waiting to get seen? Do you think that they would think that that's an acceptable outcome for their child?
The government doesn't regard ramping as acceptable. That's why we're taking a range of measures, adding almost 400 additional beds to the network. That's why we're introducing the virtual urgent care service of the Women's and Children's Hospital. Almost 700 families in the Women's and Children's Hospital community have benefited from that additional service. They know the Women's and Children's Hospital will be there when they need it.
What's a relatively short space of time yesterday, Minister?
I don't have the details, but my understanding is that it was not extended.
But why don't you have those details? You can sit there and look down that camera and say it's a relatively short space of time, which to anyone listening to that would seem, oh, that's not actually that bad. But you can't actually provide the specific details.
I'll get that information for you, Andrew.